Hi, I'm Christina. I'm one of the nurses who will be assisting Dr. Bob in your surgery today. I understand that you might be a bit nervous going into the surgery today, but I wanted to give you a little bit of background information to help ease some of those concerns and some nerves, and also help you get a clear understanding of what exactly it is we're going to be doing. Today, Dr. Bob, the dermatologist that you have been seeing, will be performing what is called Mohs surgery. Dr. Bob has been specially trained to perform the surgery, which targets the cancerous tissue and focuses on conserving as much healthy tissue as possible while leaving the smallest scar possible. As you already know, Dr. Bob has recently diagnosed you with the type of skin cancer known as basal cell carcinoma. I understand that might be a little bit frightening to hear words like cancer and carcinoma, so I want to give you some more information about this type of cancer. That way we can help ease some of those fears associated. Basal cell carcinoma is a type of skin cancer characterized by abnormal, uncontrolled growth or lesion that arise in the skin's basal cells, which line the deepest layer of the epidermis. The epidermis is just the outermost layer of the skin. This type of skin cancer is the most common form, and although it is a form of cancer, only in rare cases does it metastasize or spread to other areas. However, if it is left untreated, it has the potential to be life-threatening. Thankfully, you're about to receive the most targeted and effective treatment for the type of skin cancer you have. As I previously mentioned, Dr. Bob will be your surgeon today. He's a dermatologist, which means he's a medical expert that specializes in dealing with problems and diseases concerning the skin. Dr. Bob is especially qualified for this type of surgery because he has been vigorously trained to perform Mohs micrographic surgery. A micrograph is essentially a picture taken with a microscope, and for this type of surgery we take many pictures of your skin under the microscope to ensure that we get all of the cancerous cells taken out. Dr. Bob will go layer by layer to ensure that all of the problematic cells are excised, which just means that they're removed. We'll start off the surgery by defining the affected area using a skin marker. This helps the surgeon know exactly where to start, and then from there we inject the local anesthetic, which is something we use to numb the affected and surrounding areas so you don't feel anything. Dr. Bob will then use a scalpel, a very sharp cutting tool, to remove a thin layer of the cancerous tissue. After that, I will bandage the area and see you to the waiting room while the layer of tissue that we took out is removed, colored, frozen, stained, and then sliced extremely thin so that it can be examined under a microscope. Dr. Bob will then go to your sample and examine it and see if there's any cancerous tissues still remaining in that sample. If there is, he pinpoints exactly where they are, and we bring you back into the procedure room to repeat the process. We do this again and again until Dr. Bob finds that there is absolutely no remaining cancer cells. After the last collection of tissue is found to be cancer-free, Dr. Bob will close the wound using stitches, and then we will bandage you up and give you wound care instructions. As you can imagine, going layer by layer, the whole process can be very time-consuming. However, as I mentioned before, it is the most effective way to treat this type of cancer because it removes all of the cancerous cells, and we make sure to remove that. The total amount of time this surgery can take varies greatly from patient to patient, and as such, it's determined on a case-by-case basis. Because of the size of the affected area is a bit larger for you, it will more than likely take longer to ensure that you have no remaining cancerous cells left. Another topic that I feel like I need to discuss with you is the likelihood of scarring. This procedure is designed to leave the smallest scar possible. However, there is a greater chance of scarring if a greater area is affected. One way to ease the significance of a scar is through proper wound care, and we'll give you instructions on how to properly take care of your wound. That's caring for the incision site, and then we'll set you up to get your stitches out in about 1 to 2 weeks from today's surgery. I know that it can be really scary going through a thing like this, but I'll be here to ease your fears. I'll be with you through the whole way during your surgery, and I'll be there to answer any of your questions. Really, I'm there for you and to help you If you have any questions at all, just let me know. Otherwise, let's go ahead and get started. Thanks.